Insurance eligibility verification is one of the most error-prone tasks in medical billing, quietly draining revenue before a patient even walks through the door. Front desk staff are operating at a chaotic pace. Between ringing phones, patient check-ins, and a constant stream of incoming patient data, they are forced to rush through complex insurance verifications just to keep the waiting room clear. That rush has a mathematical cost. Across the industry, the initial claim denial rate has steadily climbed to 11.81%. Healthcare data shows up to 90%. You spend 3 months training a new employee on payer portals and verification quirks, only to have them leave. During the ramp-up period for their replacement, errors naturally spike, and denials follow closely behind. Relying on high-turnover administrative staff to execute complex payer verifications traps your practice. You pay for permanent, continuous retraining, while preventable denials erode your monthly collections. This baseline friction is hard enough. Add Aetna to your patient mix, and the difficulty multiplies. Aetna operates a massive web of joint ventures. It is not a single unified payer. It functions as a collection of state-specific subsidiaries and legacy products that confuse even experienced billers. The parent Aetna brand fragments into highly specific lines: Banner Aetna, Innovation Health, Coventry, and Meritain. Each requires separate verification portals and unique rules. A worker defaulting to the standard portal pulls incomplete data, guaranteeing a claim denial weeks later. When electronic checks fail and staff are forced onto the phone, manual verification takes 20 to 30 minutes per patient. That bottleneck immediately backs up the entire daily schedule. Generic catch-all front desk workflows cannot parse payer-specific complexity. When staff guess the routing path, operational confusion becomes hard revenue delay. Industry revenue cycle data is clear on what actually works to stop these eligibility denials from occurring in the first place. The first requirement is shifting the timeline. Successful practices run verifications 48 to 72 hours prior to the appointment, abandoning the morning of scramble to secure time to resolve coverage gaps. They also leverage automated batch checks across the full schedule each night, surfacing red flags for the entire day in minutes rather than hours. The most effective structural change is assigning payer-specific desks. This means staff work the exact same insurance portals for the exact same payers every single shift. This repetition creates specialized pattern recognition. A dedicated specialist instantly identifies the subtle differences on a Banner Aetna or Innovation Health card and routes it correctly on the first attempt. These teams also operate on a strict root cause feedback loop. When an eligibility denial does occur, the exact code is sent immediately back to the verification desk to ensure the error is never repeated. Managing Aetna successfully requires stripping the task away from a chaotic front desk and placing it into a highly disciplined, specialized operational workflow. Because building that discipline internally is expensive and vulnerable to turnover, a growing number of practices are moving their entire insurance verification queue to dedicated outsourced specialists. Staffingly operates this model by placing AAPC-credentialed remote specialists directly inside a medical practice's existing EMR to work the verification queue every day. These dedicated teams treat complex subsidiaries like Banner Aetna and Meritain as entirely distinct, isolated workflows, ensuring they are never dumped into a generic catch-all process. They pair this human expertise with specific technology. Staffingly uses an AI mechanism called Smart 270 routing to eliminate manual sorting errors. The AI evaluates the patient data instantly and automatically directs the inquiry into the correct specific digital pipeline, whether that is standard Aetna, Banner, Innovation, or Meritain. This automated routing completely bypasses the manual guesswork that causes in-house front desk staff to pull incomplete benefit data. Bots execute the repetitive, high-speed portal sweeps, while the certified human specialists review the complex carve-outs, exception rules, and coordination of benefits. Relinquishing direct internal supervision of this task yields a hybrid automated system that drops complex verification error rates below 1%. To evaluate this operationally, we have to look strictly at the financial inputs required to maintain your current status quo versus the outsourced alternative. Hiring an in-house verification specialist costs between $55,000 and $84,000 annually when fully loaded with salary, benefits, payroll taxes, and the cost of turnover replacement. This chart compares a median $77,000 in-house setup against the Staffingly model at $20,000 annually, just $399 per week, with zero training or benefits load. This generates baseline savings of up to $63,000 per year before accounting for recovered revenue. The outsourced model mathematically eliminates the crushing overhead of continuous front office turnover, directly protecting your bottom line from preventable errors. The primary hesitation practice leaders face is the perceived friction of integrating an outside team into their daily internal operations. Staffingly resolves this by starting every engagement with a 14-day risk-free pilot. You can test the workflow on a single location or a specific specialty before making any permanent operational commitment. Instead of a chaotic front desk, your verifications are managed by a dedicated remote specialist operating with calm precision in a distraction-free environment. The integration timeline is rapid. Most practices go live in 5 to 10 days, guided by a single dedicated point of contact. And patient data remains fiercely protected. Staffingly operates under SOC 2 Type 2 and ISO 27001 certified information security controls as an uncompromising baseline. Initiate the 14-day pilot. Free your internal staff from administrative burnout, measure the measurable drop in your denial rate, and let the math make your final decision.